Now, I want to just touch on, because we haven't gotten into this, to make a simple point. We have, uniquely in the industrialized world, a healthcare non-system which is dominated by private corporate interests. I just want to touch on a few of those aspects of that. When you talk about healthcare costs in America, you're always talking about the cost of medicine. Prescription drugs are very expensive. In America, of course, we pay by far the highest prices in the world for prescription drugs. Let's just talk about some of the major pharmaceutical companies and the role they play in making our healthcare system by far the most expensive in the world. Let's start off with the largest, Pfizer. Some of you may know this, but just this year a jury found that Pfizer owed the state of Wisconsin $9 million for violating Wisconsin's Medicaid fraud law more than 1.4 million times. The company faces potential fines of between $140 million and $21 billion. In 2004, Warner Lambert, a division of Pfizer, pled guilty to 2 felonies and agreed to pay $430 million. $430 million to settle charges that it fraudulently promoted a drug, one particular drug, for a string of unapproved use, and included in the award was a criminal fine of $240 million. In 2002, Pfizer agreed to pay $49 million to settle charges that a subsidiary defrauded the Medicaid program by overcharging for Lipitor. Huge fines. Johnson & Johnson was charged, the Texas Attorney General charged Johnson & Johnson with funneling kickbacks to Texas health officials. Johnson & Johnson. GlaxoSmithKline agreed to pay $14 million to the state of California. They also signed a corporate integrity agreement and paid $88 million in civil fines for overcharging Medicaid. Hoffman LaRoche, $500 million in 1999 criminal fine for leading a worldwide conspiracy to raise and fix prices and allocate market shares for certain vitamins. Sanofi-Aventis, 2009, Aventis paid $95 million to settle charges that had violated the False Claims Act. Wyeth, just this year, the U.S. government and 16 states have joined in 2 whistleblower suits against pharmaceutical giant Wyeth. The drug company allegedly failed to pay hundreds of millions of dollars in rebates to the Medicaid program. You know, I hear a lot about fraud and I hear a lot about waste. But what I don't hear about is the role that the major corporate giants in the healthcare industry are playing in ripping off the American people to the tunes of billions and billions of dollars. I don't know why we don't talk about that issue. That's just the drug companies. Huge fine after huge fine, and let's be clear, especially under the Bush administration, whose competence is not widely respected, and who is also known as being sympathetic to corporate interest, every fine, every charge that we have seen here, probably you can multiply many times over, that they're sitting out there with an aggressive Attorney General's office might have gone after. Let's look at some of the private insurance companies that some people here see as a model that we want to support. United Health, 2009, United Health paid $350 million to settle lawsuits brought by the AMA, state medical societies, doctors, and patients. These lawsuits allege that the company shortchanged consumers and physicians when paying for medical services outside of its preferred network. WellPoint, in 2009, CMS barred WellPoint from participating in Medicare Part D and Medicare Advantage, stating that WellPoint has demonstrated a long-standing and persistent failure to comply with CMS requirements for proper administration of its Medicare Advantage prescription drug program. Aetna, in 2003, Aetna agreed to settle a class action suit brought by physicians by paying a $470 million and overhauling business practices that doctors say have shortchanged patient care. Humana, in 2000, Humana paid $14.5 million to settle federal charges of overcharging government health programs. Cigna, in 2003, Cigna paid $24.5 million to settle allegations of Medicare fraud at a hospital it owns. All right? That's just some of what insurance companies are doing. Then you got private hospital chains. I think many people here are familiar with that. In fact, in 2000, the Hospital Corporation of America agreed to pay $745 million. $745 million to settle civil charges that it systemically defrauded Medicare, Medicaid, and other federally funded health care programs. Later that year, HCA agreed to pay criminal fines and damages of $95 million. Finally, in 2003, HCA agreed to pay $631 million more in civil fines, total of $1.7 billion. Tenet Healthcare Corporation, 2003, Tenet paid $54 million in fines to settle allegations of 2 doctors working in Redding, California, perform unnecessary cardiac procedures on patients in the interest of profits. Imagine that. Cardiac surgery in order to make money when that surgery was not necessary. 2006, Tenet agreed to pay $725 million in cash in order to resolve claims that defrauded the federal government, overbilling Medicare claims during a 6-year period. And on and on and on it goes. So when we hear, and Mr. Chairman, I would ask unanimous consent to enter this information into the record.
Without objection, so.
You know, Mr. President, I get a little bit tired of hearing about how the government can't do anything. Government can't do anything. Well, you know what? What you have seen for many, many years is a systemic effort on the part of private insurance companies, private drug companies, private for-profit hospitals, to the tune of many, many billions of dollars, are ripping off the American people and the taxpayers of this country. And then you wonder why in the New York Times people say overwhelmingly they want a government plan to compete with the private sector. No kidding. Isn't that a shock? Very few people in this country have a great deal of confidence in private insurance companies. They know that we're paying the highest prices in the world for pharmaceuticals. We get ripped off every day by the drug companies. So I just say these words, Mr. President. I don't have an amendment to offer today to deal with this stuff. But clearly we need to think about how we're going to stop the illegal, systemic, illegal behavior of many of these large corporate interests who are costing our people, our taxpayers, billions and billions of dollars. And that is something I think we'll have when we get to the floor of the House. But I thank you,
Thank you, Senator.
Mr.
Mr. Chairman.